Hello and welcome to yet another episode of Guest Room. Today we have with us Dr. Weidenmann Bertram, who have been specialized in gastroenterology. Let's welcome him to the program. Welcome, doctor.
Hello.
First of all, could you just tell us your experience in this field?
Well, as I just mentioned, I'm an expert in the field of diseases that involve the stomach, the small intestine, the large intestine, as well as the pancreas, and also the esophagus. And there we see patients that have inflammations in these organs, or they may have tumors in these organs.
Okay. So could you just explain to a layman what actually gastroenterology is?
This is a doctor that specializes in these organs, as I just mentioned to you. And we see then patients that tell us about problems with regards to pain, with regards to fever, with regards to vomiting, with regards also to diarrhea. And we then ask by the general practitioner to help the patients. And primarily we do that by looking into those organs. As we all know, the stomach, the esophagus, and also the intestine is a hollow organ. So we just can use devices. These are some tubes that allow us to go either through the mouth or from the rear end into these organs and have an image wherever the disease may sit and be.
Okay. So what are the most important health issues that you face?
Well, I think with regards to the treatments, the new treatments we now have available, there has been especially a breakthrough in the field of viral hepatitis. That is, we have, as we all know, quite often viruses that infect our liver. And we usually may feel it by being jaundiced, by having this yellow eye discoloration or yellow skin. And also combined with that, we have a dark urine, and we also may then see our stools with a much lighter color. And under those conditions, we then see an infection either with the hepatitis B or hepatitis C virus. And with regards to the latter one again, we have the great advantage that now we have drugs available that have been well tested in large studies that can cure our patients.
So how can we treat hepatitis C?
Great advancement we had in the last year was that we have two drugs that we have to combine. And once we can use those drugs, we can help all our patients by curing them and allowing them to be free of the virus within 3 months.
Okay.
Of course, there are exceptions to the rules, and there are some improvements with regards to various subtypes. There's not only one hepatitis C virus, but there are several. And to most of those subtypes we have now this combination working. Others will have to make combinations work, but in general there's great hope, and not only hope but also treatment now available.
Okay. So what are the symptoms of tumor?
If we move away from the hepatitis, the viral hepatitis infection, and look at tumors, there are several areas of treatments. One is if we stay with patients that had hepatitis C and had this disease for many decades, they eventually develop what in the past the virus could not be taken away or eliminated, as we say. Then the patients develop eventually quite often tumors of the liver. It's called hepatocellular carcinoma. And in this case, we can treat these patients in many ways. One is that, of course, once there's only one tumor, quite often there are several in the liver. If there's only one, then of course the surgeon can take it out. The other way is that we can make these tumors disappear by heating, going in with a needle into the tumor region and then heating up the region, and we just boil the tumor away inside the liver. That's one procedure. And on top of it, we have means to treat the patient with, in some cases, liver transplantation. Of course, that's a rare occasion. And finally, if all these other treatment options are not available or cannot be used, then we have also drugs that can stop the tumor growth. However, these drugs have side effects and they have to be well balanced, because these patients, by the time they develop the tumor, have cirrhosis of the liver.
So how can we diagnose it?
The way to diagnose it is first of all to use an ultrasound. This is a rather inexpensive method, and if it's used by an expert, radiological expert, then these tumors can be detected very nicely. These are the tumors of the liver, and with regards to the tumors of the esophagus and the stomach, and also the large intestine, there we of course have to detect them with an endoscope. In the old days it was a fiber optic. Nowadays we have means that we do not need glass fibers anymore, but we have chip technology that allows us, by just going in with a tube, to find these tumors. And as long as they're small enough, we can actually remove these tumors with our tubes. So we do really microsurgery in the tube, with the tube, in the hollow organ and in the tube. And by doing so, we spare the patient surgery. But this is only possible once the tumors are small enough.
So what are the treatment options given for the patients?
The treatment options for the patient under those conditions, as I just pointed out, you cut the tumor away. You just really do it by injecting some saline, some saline fluid under the tumor, and then you can lift the tumor. And by lifting the tumor, you have means to take out with an electron knife the tumor, and you just really cut it out from the intestinal or stomach wall. And if it's small enough, you can be also assured that by other means, that once the lymph nodes are not involved, that you can cure the patient with this treatment. Once the tumor is more advanced and has already involved and invaded the lymph nodes outside the organ, and then of course the surgeon has to do the first job. And finally, if the surgeon finds tumor lymph nodes involved, then one has to follow up with a medical treatment, which we call adjuvant treatment, in order to ensure that some tumor cells that are left over then are taken up and killed via the bloodstream.
So doctor, that was nice talking to you. Thanks a lot for being a part of our program.
You're very welcome.
So that was Dr. Weidenmann Bertram with us. Until we meet next time, this is me, Naina, signing off. Take care.
You